is Yasmin Melero, and I'm from El Paso, Texas. So I am actually an SLPA, so a speech-language pathologist assistant, licensed in Texas and Arizona. My background was in communicative disorders for my undergraduate, and my mom's the one that actually got me involved in the field. I initially didn't know what I wanted to do after my associates, and she allowed me to go and kind of observe her school SLP, and I loved it. And then I found out there was a medical side to it, and I was just like hooked. So I became an assistant, and then after that I got accepted into grad school probably within the next year. So it being a hybrid program was definitely a big deal for me, as well as having night classes. I'm a student who definitely still needed to continue working, even though it's not really like I can't work full time. I still get to work a couple hours here and there, and it's definitely something that I needed to do. So us having night classes and then being able to do the second part of our program online and just to honestly get placed anywhere in the United States was a big deal for me. Yeah, definitely. I do think it was definitely tough. It's not for the faint of heart, but I think any grad programs like that, I really loved my experience here, and I've been able to kind of still do things that I love to do on the side, and I have time to still have like my own personal life and still balance school out with that. Probably doing the fees and getting to see the inside of the throat, really, honestly, just seeing that side of things, and feeding is like my favorite right now. As well as swallowing. So everything that we've done in our instrumentation lab has definitely prepared us more than I know most places are able to. So we did have access to a lot of different technology that was really, really cool and really hard to even get as an experienced SLP to get your hands on. So getting that experience in graduate school is definitely a plus. Yeah, a year from now, I'm hoping to be done with school and then to go into my clinical fellowship year. I'm hoping to get a medical placement back home in El Paso, Texas, so fingers are crossed for that. However, I do feel that we've been very prepared of how to apply and what pay looks like after as a new grad, what it looks like after your clinical fellowship, what it looks like to take the praxis, a bunch of different things like that. And I feel that I'm pretty prepared to work in any setting, honestly, as an SLP. I feel like the payback that you get from it, or the results you see with like the families you help, the patients you help, from literally from the NICU all the way to geriatrics, you have a really big, important role in the life of a lot of different people, a lot of different patients. And honestly, it's such a huge field, and there's so much need for it in so many different places that I truly love what I do, and I think working with all the different patients and families that I have worked with has definitely continued my passion to continue growing and just to keep expanding and seeing what else is out there, but I really love my job. Yeah, I think it's a really good program, especially with all the hands-on work that we get and all the different chances they provide us and opportunities they provide us. Just with the clinical placements we can get in itself are a really big deal. And if you ever wanted to go home like your second year, or if you wanted to go anywhere out of state, really, you're able to still do that, and you're able to continue classes online. So you're not really missing out on a big portion of your life, because grad school is intense. But they still definitely give us time to have like our own life outside of here and different things like that. But our instrumentation lab is amazing as well as all our professors. They're all very diverse in their backgrounds, and just them as people, they are very passionate and really personable.